my name is Dr. John Roberts. I'm a private dental practitioner in Huddersfield. I'm here primarily to talk about the lasers that I have. I've had them for about 2 years now, and every day is a new exciting day using lasers. Lots of people can say that about equipment, but really, once you start to understand and learn what lasers can do for you, then every day there are new things you can apply it to. And one of the things I want to get across is, if you want to get a laser for financial reasons, follow a certain route. If you want to get a laser to help your patients and improve your dentistry, it's a slightly different route. And it's tying the two of them together that perhaps takes a longer than expected learning curve. Because you have to learn differently, you have to think differently. You can look at a problem you've done for 30 years and all of a sudden say, well, if I use the laser, what about this, what about that? If the end result is there's more finance for you, then so be it, factor in the cost of your lasers. If there is better patient care, perhaps at the end of it an easier placement of an implant, then it's a different issue. And if you're able to tie the two of them together, then you'll get most out of the lasers. Don't be put off by one or the other. If we then talk about taking a tooth out, I've been taking teeth out for 35 years. I have a standard way. But if you start to use the laser to make the experience for the patient more comfortable, removing the bone, de-epithelializing so the gum doesn't go in as much, if you use the diode laser to form a better blood clot so you get better healing in the final third, you don't get the ridge collapse as much, you've got a better site to place an implant, and it can make the difference between putting a bone graft in and not. But please accept it will take you 45 minutes to take the tooth out. The consumables will be more expensive, so you have to be comfortable that it's worth it for you, the patient, and then what procedures you're going to do further forwards. If you then use the laser when you're placing the implant, absolutely phenomenal healing. If you use the laser to uncover the implant afterwards, amazing, the patient's saying no discomfort at all. But it is a different way of thinking, and it comes from buying the book, going to meetings, talking to other dentists, and then applying it on a day-to-day basis. The nice thing about the laser community, though, is there's lots of dentists who want to share ideas. And really, when you go to laser meetings, as much learning is done in the coffee breaks and the tea breaks, maybe in the bar afterwards as well, learning what else you can do with the lasers, and then coming back and applying it. You have to be careful, you can't experiment, but if you take what someone has suggested and then allow the time to see how it's going to work, then just do it. Lasers don't do everything though, and there still has times when you're going to have to pick up your high speed, you'll have to pick up your slow speed, you're still going to do regular dentistry. But incorporating the laser and expanding what you can do is just fun. One way of rethinking how you do your dentistry is restorative work. Those class 5 restorations where it would always bleed, moisture control was difficult. With the same laser, the same tip, change the settings, trim away the gum, leave a supragingival margin, and then place the restoration. You still may then have to pick up the high speed to finish it off, but it's a nicer, smoother, less stressful way of doing a restoration. When you're doing crown creps or cerex, as I do an awful lot of, then using the laser just to trough, to trim away, to get rid of the bleeding, smarter, crisper impressions or scans with the cerex, and nicer fitting restoration at the end. And you're not fighting with all the blood, you're not packing cord down, you're not out at the last minute when it bleeds. There's more control over what you're doing, and then you get the pleasure from doing that. Lasers still have a role for removing hard tissue. I think more research will come on how well it penetrates into carious lesions. When you don't want to drill any deeper, either using low-level lasers or just the laser effect to sterilize and clean instead of taking away all the decay, is where modern dentistry and modern thinking is going. If you incorporate it with ozone, which I'm sure will come in, then that is going to be something for the future. The laser set up all the time, just picked in and out of the high speed, slow speed, and the laser is where it's going to go. One of the most rewarding aspects of using laser is the treatment of newborn babies and babies up to the age of perhaps 14, 15 months, releasing tongue ties and lip ties primarily because of feeding problems. These are children who want the breastfeeding experience with their mother but are unable to breastfeed or even bottle feed properly, and following nice guidelines, we can actually release a tongue tie to allow the tongue to feed better, to release a lip tie to allow the children to get the breast into the mouth and fulfill that breastfeeding bond with mother. That's a bit there. I'll just do a bit more. The whole importance is getting that good breastfeeding bond, baby and mother. And we have had situations where a mother has been able to breastfeed a child. We do a 2-minute procedure, usually with the water lace, so there's minimal bleeding, and immediately the breastfeeding experience is so much different. Even dentists are bringing their children to have this kind of procedure done. It probably also bodes well for the child in later life, where better lip and tongue function will also enhance any orthodontics they may need when they're older. We do work as part of the team here, lactation consultants, breastfeeding counsellors, osteopaths and chiropractors, and it's given a great avenue for us to work with other health practitioners dealing and healing with children and their problems of early life. The other advantage is we now are forming a relationship with several osteopaths and chiropractors where using the low-level laser on injuries, they're allowed to do it with their license and their insurance to help with problems that they were either giving painkillers for. And the use of low-level lasers in dentistry and other complementary health practitioners is another field that will just grow your practice in the